Kidney stones are hard deposits that form in your kidneys. They are composed of minerals and salts that crystallize and stick together. Imagine tiny pebbles, but made of minerals and salts. These stones can be composed of different substances, such as calcium, oxalate, and uric acid. These stones can vary in size. Some are so small that they can pass through the urinary tract unnoticed. Some are as small as a grain of sand, barely visible to the naked eye, while others can grow as large as a pea, or even larger. In extreme cases, they can become as big as a golf ball. Kidney stones can be incredibly painful, especially when they move through the urinary tract. This movement can cause sharp, cramping pain in the back and side. The urinary tract is the body's drainage system for removing waste and extra fluid. It includes the kidneys, ureters, bladder, and urethra. When stones block the flow of urine, it causes intense pain. This blockage can lead to other symptoms like nausea, vomiting, and blood in the urine. Understanding kidney stones is the first step toward prevention and treatment. By learning about their causes and symptoms, you can take steps to reduce your risk and seek appropriate medical care. Kidney stones form when substances in urine, like calcium, oxalate, and uric acid, become concentrated. These substances can crystallize and stick together, forming hard deposits that can cause significant pain and discomfort as they move through the urinary tract. Dehydration is a major culprit, as it reduces urine volume, making it easier for these substances to crystallize. When you don't drink enough water, your urine becomes more concentrated with waste products, which can lead to the formation of stones. Certain medical conditions like gout and inflammatory bowel disease can also increase the risk of stone formation. These conditions can alter the balance of substances in the urine, making it more likely for stones to develop. Diet plays a significant role. What you eat can directly impact the concentration of stone-forming substances in your urine. Foods high in oxalate, such as spinach and chocolate, can contribute to stone formation in susceptible individuals. It's important to be mindful of your intake of these foods if you're prone to kidney stones. Similarly, high sodium intake can increase calcium excretion, raising the risk. Excessive salt in your diet can lead to higher levels of calcium in your urine, which can then combine with oxalate or phosphate to form stones. Kidney stones often announce themselves with excruciating pain. This pain, known as renal colic, typically strikes in the back or side, radiating to the lower abdomen and groin. The pain is often described as sharp and stabbing, coming in waves. Other symptoms include blood in the urine, frequent urination, painful urination, nausea, and vomiting. If you experience any of these symptoms, particularly sudden, severe pain, seek immediate medical attention. Treatment options for kidney stones vary based on their size, location, and the severity of symptoms. Kidney stones can be incredibly painful and disruptive to daily life. Small stones might pass on their own with ample hydration and pain relievers. Drinking plenty of water helps to flush out the urinary system, making it easier for the stones to pass naturally. Pain relievers can help manage the discomfort associated with passing small stones. However, larger stones often require medical intervention to prevent complications. One common treatment for larger stones is lithotripsy. This non-invasive procedure uses sound waves to break up the stones into smaller pieces that can be passed more easily. Lithotripsy is often preferred because it avoids the need for surgery and has a quicker recovery time. For larger or more complex stones, ureteroscopy may be necessary. This procedure involves inserting a thin scope into the ureter to either remove or break the stone. Ureteroscopy is a more invasive option, but is highly effective for stones that are difficult to reach or too large to pass on their own. The choice of treatment depends on various factors, including the stone's size, location, and the patient's overall health. Preventing kidney stones is often a matter of lifestyle modification. Staying hydrated is paramount. Aim for 8 glasses of water daily, especially in warm weather or after exercise. Dietary changes can also help. Reducing your intake of oxalate-rich foods, sodium, and animal protein is advisable. Consulting a doctor or registered dietitian for personalized dietary recommendations can make a big difference. Regular exercise and maintaining a healthy weight can also lower your risk. Kidney stones are a common health concern, affecting millions worldwide. In the United States, approximately 1 in 10 people will develop a kidney stone in their lifetime. While they can be incredibly painful, most kidney stones are treatable with minimal complications. By understanding the causes, recognizing the symptoms, and adopting preventive measures, you can significantly reduce your risk of experiencing these painful formations. Remember, early detection and treatment are essential for optimal outcomes.